As a group, as a pharmaceuticals manufacturing arm of that the industry, what has the group been doing in terms of ensuring that the industry grows? Yes, we do know that policy sometimes is not supportive, but on your own, what has the group been doing?
Well, the group, both the Pharmaceutical Manufacturers Group of MAN and later on the West African Manufacturers Association, also working in similar lines. What we've looked at three places. First is quality, because we believe that quality is critical for competition. And so we have set standards for the industry. We've been able to monitor industry. We have established some kind of self-regulating mechanism to support NAFDAC and other regulatory agencies. So that's one thing we're doing. Secondly is that we're also looking at the possibility of creating a bigger market for the products. I told you about the story of Pfizer and fermentation plant. There's a bigger market that's required for some of this investment. And we have felt that if we can have the West African market, which is essentially one market, properly structured in a manner that any investment in Nigeria or Ghana or anywhere else will look at that entire region. So to be able to be feasible and cost effective. So we're working with our neighbors in the West Coast to create similarity, regulatory similarity, market similarity, ethical and all that quality synchrony, so that we can all talk about the same. Thirdly, we are also looking at the point of synergizing investment, because sometimes this brittle little companies, each one trying to work on its own, cannot generate the capacity, the equity,
or the
capital, the impact. So we're looking at the possibility of strategic alliances. Even if we could match, that would be nice. But even if we couldn't match, we can enter into some other level of strategic alliances where we can put resources, we can put talents and capabilities, and be able to deliver. Because the problem is being able to be competitive. We are facing an avalanche of invasion of our territory by foreign products, and in a global world that is globalized, WTO and all that, you can't resist. There's not much the government can do. It can ban the product, it can only raise tariffs, and it tries, even though when that is done, we have problem with implementation from the borders and all that. But I think that the industry believes that we should be able to stand up and compete. And the moment the competition is fair, we should be able to hold on our own, and we can't do it alone. So there's a lot of work to bring synergy and to bring some level of strategic alliance. Okay,
now while you're trying to go beyond our borders, how are our own neighbors doing? Because like I said, I was looking at some numbers too. Africa-based pharmaceutical industry is still less than 5% of the global business. So even as a continent, we're still not even making a major impact, in the global space.
Yeah, we are not. But it can only happen by this sort of concerted and determined effort. When issues like this are raised, and then visions are set that we will achieve this growth rate or this size of market at a particular time. And that is what I think that the local industry is doing, the West African pharmaceutical manufacturers are doing, and now we have an African pharmaceutical manufacturers group mediated by UNIDO and UNDP to help pull us together. Because if we don't pull together, we shall be easily overridden by the massive competition. Because as you've pointed out, pharmaceuticals contribute to most multinational, most industrialized countries, and they're always constantly looking for outlets. And they are looking in the area.
Definitely looking for markets. I mean, we're 160 million people, so definitely that's a huge market for any
exactly. They are looking in this area, and if we follow the line of least resistance, then we should just be an importing country. And that's why those who are in manufacturing need to receive specific government encouragement and support. Because I was CEO for 18 years. At some point, I thought I was crazy, because I saw what other people were doing, going to China, going to India, bring some products, package it together, and they're making more money. I mean, I'm here sweating morning, night and day, facing problem of infrastructure, energy, unfair competition. Many times I felt I was crazy, but I still managed to get through. So we need encouragement. We need the government to decide that this is an area it wants to play. We want to contribute to to global GDP, we want to contribute to national GDP, then we must put the appropriate incentives and motivation and support to be able to realize it. It needs that. If government allows things just to happen by mere resultant factors of supply and demand and market, we will be pushed to the background and production will decline. I must tell you that there was a time we got up to 50%. That is 50% local production against 50% of importation. But there was a time we've gone down to 30%. As I speak to you, maybe we're 40%. And we could go up to 60. And as I said, government has realized that in the health policy, it has a health policy, it has a pharmaceutical policy, which says by the year 1997, we should be having about 50% of our products local content. By 2007, we should have about 70% of our locally consumed products manufactured locally. Now we are 70. We have passed 2007, and we are here 40%. So I believe that the Ministry of Health, Ministry of Trade and Investment, Ministry of Science and Technology, working with Bank of Industry and the pharmaceutical leadership, must push along this line because it's going to be helpful to the entire economy.
Now, this picture that you've painted, especially the operating environment, what it's like for the average pharmaceutical company here in Nigeria, is that what it is for every single one of them operating in this environment?
Yeah. Everybody that is doing pharmaceutical manufacturing, those who are doing trading, they're in a different environment because they bring the product. There's a large population. Most of them are cheaply priced, so they can get to everyone in the market. They do 1 or 2 advertisements on television, and their product. If you check all those who are advertising, if you check those who are advertising today in the radio and television, are importers. They import goods from everywhere. The local manufacturers are still struggling to be able to have enough resources to produce. They don't have enough resources to advertise those brands. So that is the issue. For the local manufacturers, they are facing tremendous problem because for each brand, each product, let's take any brand of paracetamol, you may need 20 items to get into it. And each of these 20 items faces different tariff structure, different regulation.
Especially if all of them are imported.
Yeah, most of them are
imported.
And if you have 19 out of 20, you cannot produce. You have your warehouse filled with raw materials, but you don't have the finished product because one is lacking. Now, the man who is importing imports one item with one regulation. You can see how easy it is for him. Logistics, it's easy. Technology is easy. So it's a line of least resistance. And when an environment seems to be rewarding those who follow line of least resistance, everybody will go. Those of us who stay in manufacturing are looked at either old school or a little bit outmoded, but we refuse to accept so because no country will develop by everybody going into trading or following the least line of resistance. And I believe that government needs to recognize this, not only in the pharmaceuticals, in every sector of manufacturing. Yeah, they need to put more focus than we are. Stop paying lip service and drill down and say, what do we want to do hands-on and offer that help? It will be best for our economy.
Now, going forward, looking at the industry, the future of the industry, how do you, beg your pardon, are you optimistic? You have mentioned that the pace at which we're going is not fast enough.
Yeah.
And in fairness to the government, we do know that there's so many other sectors competing for little cash that we have.
Yeah.
You know, we're borrowing left, right, and center, and all of that. But going forward, are you hopeful that things will get better?
I am hopeful because if government pushes through the deregulation policy, the privatization policy, it will sort out a few things. It will sort out our infrastructure deficit because that contributes significantly to our cost of operations. That will be helpful. Number two, if government organizes the environment better, you know, I mean, he's doing all he can with security, but let's take the issue of multiple taxation. If multiple taxation, which the Joint Tax Board is also pursuing, but somehow they're unable to rein in some of the local governments and that are being, you know, negative to industrial work. If we can get that environment sorted out, security, regulatory, in terms of tax, in terms of who does what, and lastly, if we can put the effort which has already started in providing long-term funding for the industry, I believe that we can reverse the trend because I know a couple of local manufacturers that are already making an investment, first to take the quality of their products to be international standard, because today it's causing us problem. Where some products we are making locally, but we can't sell them because Nigeria signed some global fund, into some aid and all that, that brings the products at 1/10 our own cost. I mean, that's one that is going on now in anti-malarials. And that product is coming so cheaply, we can't sell our brand. And the reason is that the world says we can only buy from those who have WHO GMP certification. Yeah. So local industry is responding to that. A lot of investment is going on. NAFDAC is supporting to be able to get industries to that level. That's the first signal that we're going somewhere. The moment we can get to those global standards, even with our current manufacturing capability, and then we receive the support, I have said, through government, through the Bank of Industry, through CBN, through DMO, I think the situation can be improved upon.